Welcome back. Since 1995, the American Academy of Dermatology has designated the first Monday of May as Melanoma Monday. Melanoma is a preventable type of skin cancer if you catch a suspicious area soon enough. And joining us to talk more about melanoma and how to prevent it is Kimberly Ivestor, director of the Helen G. Nassif Community Cancer Center of Iowa. Thanks for coming in.
Thanks for having me.
Well, we are getting to that time of year when a lot of people want to get outside and get a start on their tans, but just talk a little bit about the importance of using sunscreen when you know you're going to be outside for an extended period of time.
Sure. Skin cancer is one of the most common cancers diagnosed in the United States, and so obviously it's very, very preventable. So using the sunscreen when you're outside and using it in the correct ways is very, very important for preventing melanoma.
Can we talk about SPF? Because there are so many rumors you hear about there about an SPF being too strong or too light. What would you recommend for an appropriate level of SPF?
SPF, the sun protection factor, really talks about how deeply it's going to protect your skin from the sun when you put it on. It's most important about how you put it on before you go outside, a half hour before you go outside, so it has time to absorb. And there is lots of different ones out there, all the way from I think 3 probably up to 50 or higher. And once you get to 30 or higher, your protection doesn't really change more than like a percentage or so, but anything lower than 30 is not really going to give you that much protection. So you want to stick with anything 30 or higher.
What are some of the short and long-term effects of having too much sun exposure?
So the short-term effects are obviously all those ones that we can see, the blistering of the skin, the redness, the inflammation. The long-term effects are all the ones that we worry about now when we should have been worrying about them later, as far as sunspots and wrinkling and so forth.
And what should you do if you notice something that looks suspicious, not right on your skin?
Definitely should have it checked out. The big thing with skin cancer is catching it early. So the big things that we have people look for is if they have a new area, if they have an area that has changed in size, has changed in color, or just doesn't look like what it looked like 6 months ago.
And if you do get, say, a biopsy done on a suspicious looking mole and you do get that diagnosis of melanoma, what does that mean?
It really means that everybody's situation is definitely different in regards to how early it was caught or so forth. But the big things with melanoma is that you are prone to getting it again, because the reason that you got it, all those factors of this being out in the sun are still there. So with melanoma, it's just following the recommended follow-up that your provider provides to you, making sure that you're getting the screenings and getting the long-term follow-up for that.
Preventable, and that's the biggest piece about all of this. And if you do have some questions, you can give the Melanoma Clinic a phone call, and I believe we have the phone numbers for that. If we haven't put them up on the screen already, there you go, 558-4876, also 877-242-4999. Kimberly, thanks so much for coming in today.
Yep, thank you.
And coming up tomorrow, our hubby dietitian will show